generous funding from the Tsao Foundation and research grants from MOE, MOH, and NUS has allowed our research team to pursue a variety of issues surrounding the needs and preferences of older people. I'd like to give you an example of some of those projects. One has to do with a project we recently launched on caregiving, and it was a survey of caregivers for older adults, and our focus was really on caregiver burden and caregiver stress. And we found that actually caregiving is not always a burden and a stress, but it actually has positive rewards to the caregiver as well. Our findings did indicate, though, that caregivers need to be better trained to cope with the stress and some of the mental health and physical outcomes of providing care in and out of 24/7. So we have sent these results to the policymakers, and we hope that we will see some changes in future. Other studies we've been looking at include trying to estimate how healthy a person will live now that our life expectancy is 84.5 years for women in Singapore, for example. We estimate that 8 out of those years she'll have an arthritic problem, and about 7 of those years she'll be hypertensive. Men, on the other hand, spend fewer years in ill health. So for an older man, he may spend just 7 years hypertensive, for example, and much fewer years with an arthritic problem. We have other projects that look at the needs and preferences of older people for long-term care services, because we know in Singapore that there's a lot of underuse of long-term care services, and so we work with the Agency for Integrated Care to try and understand why Singaporeans are not using daycare centers, dementia centers, and in particular rehab centers, because stroke rehab can be fantastic in terms of improving one's quality of life. Never before has an issue like population aging galvanized the social sciences, the biomedical, the engineering, architecture, and other areas. I'll give you one example. A dementia patient who is at a memory clinic at Singapore General Hospital. He requires medications from a clinician. He also requires help from a social worker. And when he is at home, he requires a safe environment. And that is where the architects and the engineers come in. We have actually found that working together with a variety of partners has led to several success stories, one of which is a project that we call SCOPE, Self-Care for Older Persons. Here we worked with NGOs, we worked with clinicians, we worked with epidemiologists, sociologists, economists, and we found that our pilot program, which basically teaches older people to manage their chronic conditions like diabetes, hypertension, and COPD by themselves, resulted in considerable improvement in their quality of life. And one of the main findings was that people in the program, compared to the control group, started to fill their prescriptions. I think before they were just so confused with what medications they had to take that most of people just didn't fill their prescriptions. Men in particular were the most likely to fill their prescriptions, and they're often the hardest group to motivate to change health behaviors compared to women. So my hope is that the research that we do will continue to provide findings like this. The SCOPE program, by the way, is being rolled out nationwide at senior activity centers later this year. My hope is that our research will continue to provide evidence for policymakers to make Singapore a place where older people can age productively and successfully in the future.